In this video, I'm going to share with you about how to use the AED. When you arrive with the AED, inform the CPR person to continue CPR. Now before you open the AED, look out for the three dangers: water, metal, and also flammable gas. Now if any one of these three dangers is present, do not use the AED. Once it is safe, open the AED. Take out the chest preparation kit and also the AED pad. The next step is to turn on the AED and follow the instruction.
Remove pads from package and apply to patient's bare chest.
In the chest preparation kit, there are 4 items: glove, scissors, shaver, and towel. Now before you apply the AED, there are 5 things you need to look out for. Is the casualty's chest hairy? Is the casualty sweating? Does he have any necklace? Is there any pacemaker? And also if there's any plaster on the body. Now notice that the AED pad have an indication of where you are supposed to apply. So look out for the 5 items on these 2 areas. To apply the AED pads, wear the glove first. Take the scissors and cut away the clothing if there's any. Now remove the clothes to expose the chest. If you notice any chest hair, take the shaver and shave on the area where you need to apply the pads. If the casualty body is wet, take the towel and dry the 2 areas where you need to apply the pads. If you notice any necklace, move it aside. Any plaster at these 2 areas, remove. And finally, look out for the pacemaker on the right chest. Once the chest preparation has been done, you may apply the pads based on the picture. The next step is to plug in and follow the AED instruction. Now the AED will give 2 types of advice, either to shock or not to shock. So let's take a look what to do for each scenario.
Remove pads from package and apply to patient's bare chest. Do not touch the patient. Analyzing heart rhythm.
When the AED is analyzing, make sure you shout "stand clear" and nobody touch the casualty. CPR also have to stop. Let's take a look at what to do if the AED tell you to apply shock.
Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now.
Stand clear.
Shock delivered. If needed, start CPR.
After you deliver the shock, follow the AED beeping sound and do the CPR. Here's an example.
Shock delivered. If needed, start CPR.
Now you have learned what to do after you apply the shock. Now let's take a look at what to do if the AED tell you no shock advice.
Analyzing heart rhythm. Do not touch the patient. No shock advised. If needed, start CPR.
When the AED says no shock advised, start CPR and the casualty is not moving, please continue your CPR. But what if the casualty start to move? Let's take a look.
If needed, start CPR.
Once the casualties start to move, they show signs of life. Stop your CPR, check for the chest rise, not more than 10 seconds. If the casualties start to breathe, stay with them until the paramedic arrive. Do not off the AED, do not unplug, do not give food and water, and do not leave the casualty alone. All you need to do now is to wait for ambulance to arrive and take over.